I'm Dr. Joseph Chalissery. I'm a practicing dermatologist at Cochin, Kerala. I have my own clinic, Chalissery Clinic in Cochin. So today I'll be giving you a brief overview on vitiligo. Now, vitiligo is basically a skin condition in which the skin starts losing its pigment producing cells called as melanocytes in certain parts, and the skin starts to develop white patches. Now, it can affect all races. It can affect both sexes. Common between the age of it starts between the age of 10 and 30. Now, what causes vitiligo? Now, vitiligo is basically there are many theories to it, and we do not completely know the etiology. But from what we know, the commonest hypothesis that is there in vitiligo is the autoimmune hypothesis. Autoimmune means the body starts reacting to its own tissues, perceiving it as foreign. Now, what happens here is the body starts reacting to the pigment producing cells called as melanocytes. Now, the skin starts losing melanocytes in certain patches and sometimes in hairs associated with these patches when it is called as leukotrichia. So, this is one of the reasons. Now, people often ask us whether it occurs it is transmitted hereditarily. Yes, it has a genetic predisposition. That means most of the vitiligo, about 20 to 30% of the vitiligo patients can have some other family member suffering from vitiligo or any other autoimmune condition like thyroid disease, diabetes, or patches of hair loss called as alopecia areata. So it can run in families. Now, whether if a vitiligo patient's child will get vitiligo, not necessarily. They may get, but chances are only about chances are very low. They can get in the next generation. Now, other than this, there are other theories, like there is something called as oxidative stress when your body starts producing a lot of materials called as reactive oxygen species, and these starts killing these melanocytes. That is another theory. There are different types of vitiligo. There are vitiligo with multiple patches on the body. There are vitiligo which presents only in one segment of the body. Now, some of these types of vitiligo has got a nerve hypothesis as well, or a neurogenic hypothesis, it is called. So these are the different causes of vitiligo. Now, coming to the symptoms. Symptoms are usually, so this is usually asymptomatic. The patient doesn't have any itching or this thing. What they present with is a white, chocolate white lesions on different parts of the body, usually on the face and sometimes on the hands. It can present anywhere on the body, but common types are there, the lip and tip or the acrofacial type variants of vitiligo. Now, how do you diagnose vitiligo? Coming to the diagnosis, it is often a clinical diagnosis. That is, when you meet a doctor, he will look into your skin, and sometimes with the aid of a light called as Wood's lamp, he looks into the skin, and you can know the extent of vitiligo. That is one method of diagnosing it. And there is, of course, that to confirm it is vitiligo and to differentiate it from other conditions, there is a skin test called as skin biopsy, where you take a small piece of skin, send it for testing, and we'll know if it is vitiligo or any other condition that mimics vitiligo. So all white patches on the skin are not necessarily vitiligo. Now, some of the facts about vitiligo. Vitiligo in India has got a lot of stigma. That is because since we being type 4 skin, that is a little more darker skin, the vitiliginous patches shows out on our skin. Now, this is associated with a lot of stigma. Often the patients who are suffering from vitiligo can have a very low self-esteem or can even be depressed at times. Some of the facts regarding vitiligo is not a transmissible disease. It is not a communicable disease. That means if you have vitiligo, you stay with somebody, the vitiligo is not good. The other person is not going to get the vitiligo like an infection. So it is not infectious or communicable. That is one of the facts. And a person with the vitiligo doesn't have any other internal ailments as such. You will have to check his thyroid and sugars. Other than that, there is no other internal ailments in a vitiligo patient. So these are some of the facts regarding vitiligo. Now, often people are afraid of vitiligo patients, and often there is a tendency to avoid vitiligo patients, which should not be there. Now, last, regarding the treatment. Now, coming to the treatment part, so it all depends on where the vitiligo is there, how big the lesions are, and to what extent the lesions have spread. Now, mostly for the smaller lesions or the localized lesions, we start with ointments. The topical ointments or creams is what we give. Most commonly used is a topical corticosteroid, or some drugs like called as topical calcineurin inhibitors or vitamin D analogs are commonly used topical agents for vitiligo. Now, in some patients who not or who have an extensive lesion, we can think about something called as phototherapy. This is nothing but a light treatment which is used so that the depigmented lesion or the patches which has lost color starts regaining color from the surrounding skin. So there are different types of ultraviolet lights which are available for treatment. The problem with this treatment is it has to be done in a place where this is available, and the patient has to go there for months together. It is not a one-shot treatment or one-time treatment. Now, if you have a very localized lesion, there is something called as excimer lamp or an excimer laser, which is used for a localized lesion. That is, if your lesions are very limited to certain areas of the body, you can think about the excimer lamp or laser. Another treatment, if the patient has a very fast spreading lesion, then the main aim of the treatment is to stop the spread, in which cases we might have to go in for some of the oral medications, which your dermatologist will have a look at your skin, the extent of the lesion and the spreading of the lesion, and start you on oral treatments. Now, last, if your lesion has been stable for 1 to 2 years, then probably you can think about some of the vitiligo surgeries. So some of the commonly done surgeries are the punch grafting, where small pieces of skin, normal colored skin, is taken, and uh, it is transplanted to an area where you have these white patches. Or there is something called as you form a blister, you take the blister out, and it is again transplanted to the area where you have the white patch. And there are newer therapies like the melanocytes are being cultured, or the melanocyte and keratinocytes together are cultured, and this is being transferred to a area where you have white patches. But to do these surgeries, your vitiligo should be stable. That means you should not be getting new patches over a period of 2 years. So these are some of the common treatments. Now, if you have an extensive vitiligo, you have very little patches with color, with your normal skin color, then there is then there are depigmenting agents which can take out the normal color, and the whole skin will start looking uniform, will start becoming a uniform depigmented this thing. So there are certain agents which are available to depigment the skin as well. And lastly, there are camouflage creams, which are nothing but these are like a makeup which you can use on the vitiligenous patches. This is not a treatment, but to take away, like, this is mostly the appearance is more important for them. So you can apply on, if you have localized lesions, you can apply on the localized lesions, or you have lesions on visible areas, you can apply the camouflage creams on those areas, and people don't notice the vitiligenous patches. So the message on this Vitiligo Day is that there is no stigma that needs to be associated with vitiligo. It is just like any other disease, and this is not communicable. And there is no other problems with the vitiligo patients in marrying or continuing their normal life. Thank you.